I'm joined by one of India's topmost cardiologist, Dr. Vijay De Silva. Dr. De Silva, thank you for joining. We have Shefali Jariwala. She got cardiac arrest. She looked pretty fit. So my first question to you would be, why are young people dying of cardiac arrest?
Now, this is quite an unfortunate death of a young actress. We don't know the exact cause for her death because she was brought in a state to the hospital where they could not diagnose anything, and ultimately they have sent for postmortem. The final verdict on why the death will come out of the postmortem report. But if you see the current trend in the society, is that young people, particularly in their 30s and 40s, are getting heart attack, brain strokes, blood pressure, diabetes, obesity. These are all a common problem in this age group. Previously, when I started my practice, we used to see patients getting heart attack when they were in their 60s and 70s. Over each decade, the years have come down. Last one decade, maybe around 50s. But last one decade, you see that the age is going down, down, down. And now we have people who are getting heart attack and brain stroke in 30s and 40s, which is very unfortunate and alarming. See, there is an epidemic of metabolic syndrome. This metabolic syndrome is something which is a result of poor lifestyle choices. If you see, the internet has come in 90s. The fast food was introduced into India in 90s. Pizza Hut, McDonald's, KFC.
Pizza Huts.
Similarly, all other fast food were introduced in India in 96, 97. Internet came around the same time. Now, if you look at the combination of these two things, fast food, which is very high carbohydrate diet with poor oils being used in that, and internet leading into inactivity and lack of exercise and lack of sleep. People are whole night on the Instagram and on the mobile and on the internet, so they are not sleeping, they are not exercising, they are not even doing routine activities, they are sitting at one place. So inactivity, lack of exercise, and the poor food choices. This, if you add something more to it, three more factors. One is tobacco, second is alcohol, and the third thing is stress. Stress of competitive life, right from school days to the professional life. So much of competition is there. So a stressful lifestyle, lack of sleep, lack of activity, poor food choices. These are resulting into an epidemic of obesity, diabetes, blood pressure, brain stroke, heart stroke, and early onset of kidney failure also. So this is a combination of poor lifestyle choices, and everything is avoidable. That a person chooses a healthy lifestyle, he can prevent all these diseases. All these diseases are preventable, 100% preventable, provided they are guided well and if people choose healthy lifestyles. Now, if you look at, there are addictions in the society. You will be surprised to know what is the number one and number two addiction in the society. They are not alcohol, they are not tobacco, they are not drugs.
Mobile phones, smartphones.
The biggest two addiction is addiction to salt and the sugar.
Okay.
Now, this addiction begins in 100% of the kid from their childhood because the parents themselves give them chocolates and give them chips to start with. The chips, salted chips and the chocolate, these are the favorite thing for a kid. And the parents themselves are responsible for giving it to them, and the child gets addicted to it. They get craving for it.
Correct.
And this whole continues in their teenagers also and continues further also. So salt and sugar are the biggest culprit, two addictive culprits in the society which are not seen. They are unseen. They are everywhere and nobody is bothered about it. So the parents should make informed choices about what food they give to the child when he starts eating. They should not be giving them chocolates and chips. They should be giving them home-cooked food, healthy food, so that the child themselves develop healthy choices and they don't get addicted to salt and sugar.
So, doctor, you are saying that it's not just about coming into 30s and 40s. So, basically, the training or a healthy life should start right from the childhood. So, the chocolates and the chips that we give to kids out of love should be avoided. Am I correct?
Yes. See, this metabolic syndrome which is there, in which the triglyceride level goes up in the body, sugar level goes up in the body, the blood pressure insidiously creeps up. Now, these things are not producing any symptom in the body. So, a person is getting damage from inside, his arteries are getting damaged from inside, and he does not know till the damage is already done. See, when the person gets a heart attack, that means his artery is already blocked, coronary artery.
Correct.
Now, this block does not come within few days or few weeks. It comes over a period of a decade. When the kid is in the teenager, at that time the deposition starts.
Okay.
Now, previously it used to be a slow deposit and manifesting in 60s and 70s. Now, because of the poor lifestyle choices, this blockage starts early and manifests early. So
Okay.
if you screen the teenagers, people who are in 18s and 20s, if their bloods are checked, you'll find that their cholesterols are high, triglycerides high, quite a lot of them may be high sugars, which goes undiagnosed for years together because they do not produce any symptoms. So a healthy lifestyle should start from the childhood, and in teenagers, the parents should start annual health checkup for their kids and screen them for all these metabolic problems and prevent them and correct them, so that the events like sudden cardiac death. If you look at in the media, you'll find so many instances where healthy people doing exercise have suddenly died, or
Correct.
marathoners have died, or people are just found dead. They are just dead in the bed. They're sleeping
Correct.
and they're died. So all these things are heart attacks and arrhythmias,
Okay.
irregularities of heart beating, or the blockage of the coronary circulation. All this resulting from blockages into the artery because of the coating, cholesterol, and sugar.
Sir, for a seemingly healthy child or a teenager, what do you think is the right age one should start a regular or a routine health checkup?
18, 18-year onward, every year they should check.
Okay,
Anybody
that's
who's
that's a
18,
very important thing to know for people who will be watching this
yes. Now,
video.
if you look at if I tell as a doctor also, or even anybody tells a 18-year-old that you should get a health checkup, they'll brush
That's
it aside.
interesting.
Yeah, I'm absolutely healthy. I'm hale and hearty, right?
Right.
This is what happens.
Okay. And
So they have to take an informed choice. Ki the current scenario is such that an 18-year-old is start of an illness. So they should take preventive action from that age only. Because if you start taking preventive action after crossing 30 or 40, you already done the damage is already done. So
okay.
there's no point in doing preventive health checkup at that point. So prevention should start early.
Doctor, we also see in our daily lives these days, like a lot of people go for diet, a separate diet plan without actually getting a doctor's advice. They like one meal a day, intermittent fasting and whatnot. Like I don't eat beyond one meal or maybe two meal a day. So what exactly do you think that's also a worrying trend?
Yes, yes. See, what has happened is in the age of this media age, where information is readily available on the Google, YouTube, everywhere the information
Yes,
is
yes,
available. So there are so many experts who have spotted up, even without any background knowledge or expertise or any qualification, people are advising diets.
correct.
Now, a healthy diet is always good, should be taken the advice from either a qualified dietitian or a doctor. See, the extreme diets can be harmful. There are diets which are absolutely unusual. It should dangerous diets, and always I suggest that take an advice of an expert who is an expert in the field, either in the diet field or a medical person, to take diet advice. Extreme diets are all unhealthy and dangerous. See, a simple formula for diet is that you should have enough carbohydrate, enough protein, and adequate number of amount of fat. And medically, it has been defined how much carbohydrate, how much protein, how much fat a person should take. Now, there are diets in which people say take zero carbohydrate diet. That's
Correct.
not possible. That's unhealthy. There are diets in which they say don't take any fat.
Yes.
That again is unhealthy. See, the body needs all three components. It needs fat, it needs protein, it needs carbohydrate. So you can't take out one component out of it to control a healthy diet. You
I
can't have a proper weight if you don't take carbohydrate or if you just take out fat of the diet. So diet has to be balanced diet, enough amount of carbohydrate, enough amount of protein, and enough. See, the whole hormonal system works on fat. Now, if you take out fat from the diet, your whole hormonal system is going in a tizzy, and
correct.
you will get
Correct.
into problem.
This basically, this is important for many youngsters who go to gym and then they are on a very specific diet. They don't eat, they don't have breakfast, they don't have chapatis. They say like, I am only on this particular diet. So I think this
Yes,
is
yes.
an important advice coming from one of India's topmost doctor. What is that one sign to catch, or maybe a couple of signs that you catch if you are in your 40s or on the wrong side of 40 and you are, what are the signs that one should be watchful of?
Science basically, see, there is a healthy BMI, body mass index defined. Now, it is a simple thing. Everybody can do a calculation on their own. They need to just know their height in centimeter and a weight in kilogram. And go on the Google, put this thing BMI calculator. You get a BMI calculator. They put your height and weight and your age. You get a your BMI.
Okay.
Your BMI has to be below 25.
Okay.
If your BMI is above 25, that means you have excess amount of body fat being carried with you. So simple thing is calculate your BMI. If you are below 25, whatever you are doing is okay. Above 25 to 30, you are called obese. Above 30, you are called morbid obesity. So these people need to take precaution. They need to cut down their calories, and they need to start exercising. Now, anybody who warning signs of any issues with the heart is that if they get tired, extremely tired, or if they're getting pain in the chest or in the arm or in the jaw, or if they're feeling breathless at any point, or they feel dizziness. These are some of the symptoms which can be the early signs of heart issues. Now, if somebody gets pain in the chest or in the tummy, the first thing is they pop up antacids.
Yes.
The family
Yes.
says, oh, you have acidity, take antacid.
Yes.
So first the family treats it. Then doesn't settle down, then they may go to a general practitioner who may give some medicine, may or may not do an ECG to see what is going on. And then again, some more time passes. So this small things which may be nagging and insignificant will gradually go up to a stage where a person who is getting this pain, which is called as angina, will result into heart attack. So any chest pain, arm pain, jaw pain, breathlessness, dizziness, consult a doctor, consult an expert cardiologist, and take opinion. There's nothing wrong in going and ruling out that you have a problem, you don't have a problem.
Okay, so you suggest one should always rule out and not just wait for some problem to occur. Okay.
And they should not self-treat. Nowadays, people, even I get patients who come prepared with their knowledge from the internet. And they come with a diagnosis, I have so-and-so problem, give me a treatment. So they don't even want the doctor to diagnose it. They come with a diagnosis and they also know that this is the treatment, doctor please prescribe me this treatment.
Doctor, I have also seen of late a lot of videos of kids in school getting heart attack. Are kids also at risk of cardiac arrest these days?
Yes,
Is the
yes,
stress
for
level
different
going too
reason,
far?
for slightly different reason. See, one is a kid having any congenital heart problem. There can be congenital heart problem right from birth, which may have been missed.
Okay.
And these kids are prone to heart failure and arrhythmias, heart beating irregularities. So a kid may be perfectly normal, going to school, doing normal activities. But if this kid gets into some sports, extreme sports like running or playing football or playing hockey in the school, that can produce sudden death because of arrhythmias, the heart beating getting fast and the heart getting into a standstill state. So kids again should be properly screened by their pediatrician, and if the family feels that they have some issues, health issues with the child, they should not ignore it, get them checked. Another thing which is coming up in the elder kids in the school is the menace of drugs. Drugs are available in big cities near the schools, and people are targeting the young kids with MDM and all these drugs. These are again known to cause heart problem and sudden death.
A lot of people I have seen have said I've quit smoking because I want to take care of my heart, and that's why I've quit smoking. But then there is another thing that has come in, vaping. So they say that I've quit smoking and I now use these vapors and I inhale this.
It's equally harmful. It's equally harmful. It's harmful. It's unhealthy, and it's as bad as smoking. It's basic like peer pressure, you know. One person is doing and they say, "Yo, I do this. Let's go." So all of them try to ape each other.
And do you think there's also what can, as a society, as a collective, like people, what can we do to improve heart health, and what are the basic things that a locality, a society, a housing society, a school or an office should have to avoid such kind of like emergency response? What do you think should be the basic minimum?
Now, see, basically choosing a healthy lifestyle is it does not cost anything. It's just thinking and the way of living, they have to change. One is simple thing that you should stop eating all pre-cooked and pre-packaged food and food from outside, the junk food. Absolutely should be avoided. Kids should be encouraged to eat home food and eat healthy food. One. Second thing is they should get enough sleep of at least 8 hours at night. The screen should be off at 9 o'clock in the night, and the night is for sleeping, not for entertainment. So, keeping a person busy on the mobile or WhatsApp or computer at night is again one of the most harmful practice. Then third is stress. Reduce the stress everywhere. Wherever the child is getting stressed out, try to see that what solution are there so that the stress is reduced, both in the kid as well as on the professionals. The competition is so much in life now that everybody is in a stressful state all the time. A person should watch his weight, and a regular exercise and activity, even simple walking is good enough. You don't need to go to a gym to do exercise. A simple walking for 2 or 3 kilometers in a day can prevent so many diseases.
All right. I just want two very important answers from you. Like, what is an ideal sleep time?
7 to 8 hours minimum.
Okay.
8 hours.
That's one. And between walk, there's a huge debate going on, like morning walk or post-dinner walks.
No, walking, there is nothing like a morning walk. Walking anytime.
Okay.
Just the act of walking, whether it is morning, afternoon, evening, night, anytime. It doesn't make a difference. And see the health benefit of walking, fast walking, jogging, running is all same. See the walking need not be that you take out time and go for walking. If you are working, you get up out of your chair, walk around, do your work, walking, and just don't sit on the chair for 8 hours. So walking is one thing which can be done anytime, anywhere, off job, on job, anywhere.
Dr. De Silva, thank you. Thanks for your time, sir. I hope all those people watching this video confused about how many hours of sleep, when to walk, what are the early signs and all, they watch this video and probably learn from this coming from one of India's topmost cardiologists. Thank you, sir. Thanks for your time.
Thanks for having me. Thank you.